expensive. And as a researcher, we definitely want to do the right thing because if you don't, you will get into trouble. And at the same time, we also want to support you all, the researchers, to get your study done in a compliant way and it be done efficient. Without further ado, we would introduce Christy DeLuke, the director of UofL IRB, to give us the lecture on working with the UofL Human Subjects Protection Program and Institutional Review Boards. Welcome, Christy. Thank you.
Yeah, thank you. Thank you for having me today, and thanks everybody for joining today to talk about partnering with the IRB. As Dr. Hoying said, I'm Christy DeLuke. I'm the director of the Human Subjects Protection Program. We're also known as the HSPP or HSPPO, but we are the office that provides administrative support to the two UofL IRBs. And so this includes conducting pre-reviews of research, communicating the IRB outcomes to researchers, providing education and outreach, and reviewing research compliance. So those are all the ways that our office supports the IRBs. And just before we get started, I have just a few quick disclaimers. The information covered in this session is not to be used as a final IRB determination. It doesn't replace required IRB reviews. This is just a general overview. May not apply to specific projects as every situation is nuanced. So these are the topics that we're going to cover today. We're going to talk about what the IRB is and what requires IRB review, partnering with the HSPPO and the IRB, compliance considerations, and education and resources. And you can add your questions in the chat throughout the session or hold them to the end. I plan to end with plenty of time left so that we can circle back and go through all of the questions at the end of the session. So first, I want to start with what is the IRB. And so this is a federally mandated committee, and it is composed of scientists, non-scientists, and community members that make up the committee membership. And they're charged with conducting an ethical review of research projects, specifically to ensure that the rights and welfare of the participants who will take part in the research are adequately protected. And so, as I mentioned here at UofL, we have two IRBs. We have a biomedical committee and a social, behavioral, and educational committee. And based on our data that we had to report for last year, we have about 1,500 active studies open here, and we had about 300 exemption determinations made in the last year. So overall, we have about 1,800 projects, human subjects research projects happening across the university. And just within the IRB queue alone, we have typically 150 to 200 submissions in process with the IRB at any given time, from initial study submissions to amendments and other reportable events. So there's a large volume that flows through the office on a daily basis. I also thought it was important to talk a little bit about what the IRB is not. The IRB is not a data safety monitoring board. It's not a scientific review committee. It's not facility approval for where you plan to conduct your research. It doesn't replace other university institutional reviews that may be required. So grants and contracts, privacy office, information security, biosafety, radiation safety, animal safety. And so, the IRB may review information from these parties. We may ask to see the DSMB report, or we may ask for confirmation of IBC approval, but these are not handled within the IRB office. Sometimes they overlap with information that's provided to the IRB. But I just wanted to point out that these relate to research. They're all part of the overall research picture, but they're not necessarily managed within the IRB office. And I want to just briefly talk a little bit more about facility approval. So I mentioned the hospitals here, UofL Health and Norton Healthcare, but also this applies to any location where you plan to do your research, whether it's Jefferson County Public Schools or a local community center. Anywhere you plan to go in and recruit research participants, you want to ensure you have that institution's approval before doing so. So obtaining IRB approval doesn't necessarily mean you're ready to begin your research. There may be other sign-offs or things that are needed before you can get started. And so I also want to cover when the IRB comes into play with your research projects. And that is when your activities meet the definition of human subjects research. So the first question is, are you doing research? So are you doing a systematic investigation designed to develop or contribute to generalizable knowledge? So if yes, the next question is, does your research involve human subjects? And that would be a living individual who you're going to interact with. And that could be even by sending them a survey, that's still an interaction, or who you're going to interact with their identifiable data or specimen. So if you're doing research and it involves interacting with a person in either of those ways, then IRB approval is most likely required. So as you think through your project and where it falls within the regulatory requirements, our team can help with any questions you have. I encourage you to reach out to us early on, especially if you're unsure of whether your activity meets this criteria. Additionally, I will say that the level of IRB review a project requires is going to depend on the risk of the research, of the risk to the participant. And so anything that is greater than the risk someone might encounter in everyday life will always receive review by the full committee that's made up of the scientists, non-scientists, and community members. Where research that is minimal risk can be reviewed through other processes, typically by an IRB chair. And so I know most of you are familiar with the Belmont report, but I just want to touch on it briefly because this is the foundational document in the ethics of human research in the US. And so this was developed back in 1979 to outline the ethical principles for research involving participants. And it was especially in response to past research abuses, such as the Tuskegee syphilis study. And so most of you are familiar with this report and the foundation that it set. So I'm not going to go into detail, but the core principles are outlined as respect for persons, beneficence, and justice. And you can see the description and the application to research within the table here. But this report forms the foundation for the other regulations that we now follow, such as the Common Rule, which outlines the IRB requirements and informed consent requirements. I've also included the Common Rule OHRP regulations and the FDA regulations just for reference at the end of this presentation. So when you get a copy of the slides, you will have all of those applicable regulations handy. But this Belmont report, it also establishes the framework for the IRB approval criteria that is outlined in the Common Rule. So this is specific to the criteria that has to be met before an IRB can approve a research study. So by regulation, the IRB members have to make sure that there are plans in place to minimize risk to the participants, that there's plans for equitable participant selection and fair recruitment, that there's adequate plans for obtaining consent and documenting consent, and that there are plans in place to protect the privacy and confidentiality of the participants and their data. So the IRB cannot approve a study if any of these areas are lacking. And so that is when we may send it back and we have to ask for additional changes. So now that we've done just a quick overview of what the IRB is, I want to switch gears to talk about partnering with both the HSPPO and the IRB to help navigate your submission. So first and foremost, the HSPPO staff are great partners in your research processes. We have IRB analysts that are assigned by departments. You can scan this QR code here, or when you get the slides, there is a link to this page, but you can go to see the list to see who the IRB analyst is for your department. And from general questions to study-specific guidance or navigating IRIS, our team can help. And so we encourage you to reach out to us early on or as soon as you run into a challenge or question. We have a team of 12 that is made up of IRB analysts. We have a compliance team and we have an administrative team. And so, as I said, we are here to help. And so please don't hesitate to reach out to us. We also work all day on Microsoft Teams. So that's a great way to chat with us or reach out for general questions or quick questions through Microsoft Teams. And this is just an overview of our website. And I want to point out some of the places with key information for you to navigate to. And you can follow along by scanning the QR code on this page as well. But this is the best place to find information to support your IRB submission and your ongoing research activities. As I said, we are here to help partner with researchers across the university and help make this process as efficient and streamlined as possible. We offer trainings that can be tailored to your group or department, and you can request those from our website homepage. We have a link right here where you can fill out a Microsoft form to request a training. We also have templates available. We have protocol templates and informed consent templates. They have all of the required elements that the regulations call for, and they just need your study-specific information inserted. So we have those available as well. We also outline the process for submitting a new study step by step, and we have a self-guided lesson that is on soft chalk that goes through submitting to the IRB as well. And so there's multiple ways that you can interact and work with our office. And really our website is kind of that starting point to get to the information that you need. I mentioned the self-guided soft chalk lesson, and this is just a little snippet of it. But this covers preparing your IRB application, writing your protocol, and it's geared towards minimal risk research, but it's a tool that's available to support faculty, staff, students, residents, fellows, anyone who's new, anyone who's been at the university for a while. It's a helpful tool, and it's something that goes through each section and tells you what the IRB is looking for. So I do strongly encourage that you use this and that you pass this on if you are teaching or mentoring or training anyone who's new to working with the IRB. This is a helpful overview, really regardless of the type of research you're planning to do. As I mentioned, it's geared towards minimal risk, but the process and the information is very similar for any type of research. So I think that they will find it helpful to utilize. And so I know there's a lot of research systems at UofL and a lot of new systems, but the IRB is still using IRIS. So all IRB submissions are handled in this system. You log in with single sign-on. Your information that you use to fill out your IRB application is going to come from your research protocol. And we're going to talk about some key considerations that can help facilitate your IRB review in the coming slides. But all submissions to the IRB are handled under the study assistant module. We often have where someone has started an IRB application under project assistant or somewhere else. So I just wanted to point out that we are under study assistant. You may navigate to the conflicts of interest module to fill out your annual conflicts of interest form, but make sure when you want to start your IRB submission, you are under study assistant. And you can change which module you're in by hovering over this My Workspaces. So let's talk a little bit about key protocol considerations. And so when submitting to the IRB, the protocol and the informed consent are really key in helping to ensure a smooth review process. And I'm going to go into detail on both of those. But first, let's start with the protocol. So as you're working through an IRB submission, there are key considerations to keep in mind. And we are happy to brainstorm through these areas ahead of time. We can link researchers to IRB chairs to discuss scenarios when it's things that staff may not be able to answer. And these considerations can vary depending on the type of research. Behavioral study versus a clinical research study, they might be different, but these are key areas to think through because the IRB is wanting to understand the participants' flow throughout the study, what the participants will encounter and when, how the risk to the participants will be minimized, including risk of loss of confidentiality. And so it's important to use lay terms to anyone outside of your field We have very knowledgeable staff and chairs, but using these lay terms help facilitate the understanding of exactly what the participants' experience in the study will be. You need to consider who should be included in the study, safely as well. You want to think through your criteria for the participant population that you plan to enroll. So what would qualify someone to be included and what would exclude someone from being included? And really outline your study design to establish what the participants are going to experience. And that includes developing a schedule of events, outlining your study procedures and when they will occur. And the level of detail in your schedule of events is going to depend on the risk level of your study. And you can allow for time frames here. And some things may need a more specific time frame. If you're doing lab work every 7 days, you may have a time frame of every 7 days plus or minus a day. Whereas a survey study, you wouldn't need as descriptive of a time frame, but you should have some reference on when your survey collection should occur at what time points. You also want to establish your criteria for monitoring data for participant safety. And this is an important requirement for any research that's greater than minimal risk. What plans are in place to monitor the study along the way to ensure that there are no signs of concern or areas that need to be adjusted or amended in the research protocol? It's also important to know any FDA requirements that may apply to your study and plan for those early on and have those conversations with the FDA if needed. Even when using approved drugs and devices or vitamins, herbals, and supplements, or even now software that might be being used as a medical device, there are additional risks to consider and there are additional FDA requirements to consider that may need to be included in the protocol or justified in some way within the protocol. And then lastly, you really just want to ensure consistency. As you're thinking through your study and you're developing your project, it's easy to make a change in one place and not update it in another. And so that is one of the areas where when a study comes into the IRB for pre-review and an IRB analyst is looking at it, any of those discrepancies of information are going to be pointed out for the IRB chair review, and they will have to be updated, which would mean we would have to send it back. So it's very important to proofread and just double check all of that and all of the consistency before actually submitting to the IRB. The other important thing to consider is related to your informed consent document and your informed consent processes. So when you're planning your study, you need to think through your logistics of how you will obtain consent from your participants or their legally authorized representative. Because the IRB will need the details from how you plan to recruit and identify participants to how you plan to conduct the consent process with the participants. So you want to think ahead on what may be challenging based on the nature of your study. For example, are you enrolling participants in an emergency setting where you need to think through how you will obtain consent or how you will find a legally authorized representative? Are you enrolling minors where you need to think through parental permission? And so think through those challenges early so that you can plan ahead within the design of your research study. The IRB, similar with the protocol, they have to be able to follow the participant's experience through the consent process. And so think through also how you're going to document it. Will you have a signed consent? Will you request an unsigned consent where an information sheet is given to a participant, such as a survey, where they're given the information, but by answering the survey questions, they agree versus providing a signature? Or do you want to try an electronic consent process with an e-signature? Those are all things to think through based on the nature of your study and if participants will be face-to-face or remote or virtual. And when a study, there are chances where there are cases where studies can have more than one consent process if there's different participant groups. We're seeing this more and more. You may want to test a device in a certain group of participants, but then you may also want to survey residents to get their feedback on using the device in the clinic. So there's going to be 2 different consent processes for your 2 different participant groups. And those are important to think through for an organized study design. And you can contact our office for questions or to talk through these nuanced scenarios at any time. We're happy to help ensure that your study is set up to flow successfully. Another key consideration that I wanted to briefly mention is responding to IRB requested changes. So part of the IRB review process may include stipulations coming back to you from the IRB reviewer. So the IRB reviewer, they know what's presented to them in IRIS and in the documents attached in IRIS. So there could be changes requested based on their interpretation of the materials. Perhaps maybe there's missing context or information or a misunderstanding. And so changes are sent back through IRIS and you get an outcome letter to notify you that comes to your email. And you actually go back into the IRIS system to respond to the changes. And I just want to point out to please reach out if the changes do not make sense. Your IRB analyst who's sending the letter will be noted at the top of the letter in the table. And they are the first point of contact that you can connect with if you have questions. And when responding, we ask that you provide rationale if you don't make a change. For example, if the reviewer asks for something and maybe they didn't quite understand something, maybe you don't need to make that change, but maybe there's clarity that needs to be added to the protocol to clear up the misunderstanding. And so when responding, please provide rationale for any changes not made. It's also important to communicate if you make any changes beyond what the IRB has requested. And by doing that, it will ease the review process when the study comes back, because then it makes the re-review more efficient and clearly explains any differences between what the IRB asked for and what was submitted back. And that can save a lot of time when your submission is reviewed. A few other key considerations that I just want to briefly cover are some hot topic areas that you should have on your radar if you're developing research in these areas. And these are data privacy and security considerations. And they're growing significantly. There are UofL policies and procedures in place outside of the IRB review that can impact protocol development and should be consulted early on in your protocol development and even in your grant development stage. So software in particular, and this could be apps, algorithms, wearable devices. So UofL has to ensure protection of research data going into any third-party vendor or cloud storage. So anything that's going outside of the university. And so this can impact the development specifically for investigator-initiated studies where you may be testing a phone app or a wearable where data may be accessed by some third party. And so you need to reach out early on in the protocol development phase, as I mentioned, even in the grant development phase. And so we can connect you with the appropriate contacts to get the study that you're wanting to do reviewed to make sure it's set up to run successfully and meet all institutional requirements here at the university. And international research is very similar, even by remote means, such as doing a survey or interview through a web-based survey or interviews through Microsoft Teams. If you're doing anything that involves international research or international data sharing, there are additional privacy and legal reviews that occur. And this is because countries have very specific data privacy laws and that they're rapidly changing. And the reviews are necessary to ensure that UofL can comply with the requirements of the specific countries. And some countries also have specific requirements for consent. And so it's important to have the discussions with UofL legal and privacy offices as early as possible as you're developing your protocol and mapping out your study logistics. And as I mentioned, our office can help make these connections with the appropriate individuals even before submitting to the IRB so that you can work through these things ahead of time. So now I'm going to switch and talk a little bit about some of the key compliance considerations. And so first I want to touch on investigator responsibilities. So the principal investigator is responsible for the overall conduct and compliance of the study. And so even if things are delegated, which they can be, the PI maintains oversight and ultimate responsibility, even for the things that have been delegated. Fellows, residents, students, research projects have to have a U of L faculty or staff member serve in the role of PI. So anyone who's in a training program will need a faculty or staff mentor to serve in that role. And it's best practice to ensure that you have written documentation outlining what is delegated and ensuring that your study team members are trained on what they've been delegated to do. In some cases, a research sponsor may have a specific document for you to fill out, such as a delegation log. For other studies, for investigator-initiated studies, it's in the best interest to document what's being delegated. We have tools and resources available on our website, and we can conduct trainings. So please partner with us to ensure you have the information and tools you need to successfully lead your study. And to go through a few more investigator responsibilities, investigators are key in setting the foundation for running a compliance study. And these responsibilities include, but are not limited to, following your IRB approval for the study, training your study team on the protocol and the consent procedures. How will this take place? How will it be documented? Establishing departmental research policies and procedures when relevant. Having plans for data management and storage. Where is your research data stored for a particular study? Where is it archived after the study's completion? And developing study team communication plans. So how is the study team communicating? Who sends out the IRB approved documents to the team? How do people know where to get the most up-to-date information? These are all things that can cause compliance issues if they're not at least mapped out or communicated to your research team ahead of time. And just setting an environment for conducting compliant research, having the procedures in place to navigate the various logistics, and having tools in place to document your research activities. We have training log templates, adverse event logs, screening logs, consent form checklists. Sponsors typically provide these, but for investigator-initiated studies, we do have tools on our website that you can download and you can modify to fit your specific study. And when I send these out, you'll have access to the hyperlinks to get to those. As far as your study team makeup, anyone who is interacting with participants or with their identifiable data or specimen for the purpose of the research needs to be on your IRB study team in IRIS. The IRB requires that they have the city human subjects and HIPAA research training before they can be added. That training is good for 4 years. Everyone doing research has to fill out an attestation and disclosure form. It's also known as a conflict of interest form, and that's done in IRIS as well. And everyone has to have a CV loaded to their IRIS profile. So if all of those are completed, they can be added to a research team. So this is the second self-guided lesson that we have available on our website homepage, and it is on conducting compliant research. And it covers key areas to ensure when navigating research compliance once your study is IRB approved and up and running. So it covers informed consent, compliance tips, participant interaction, protocol adherence, reporting to the IRB, data management, and record keeping. And so this is a great way to have a quick refresher and also educate those who may be new to human subjects research. So I do encourage you to take a few minutes to review this module and share it with anyone on your research teams and within your department. It's a great refresher and a great overview. And so I just want to wrap up the compliance section with this reminder. If it's not documented, it didn't happen. And good research documentation is key because it protects the participants. Accurate documentation helps to ensure that the participants are prioritized and safeguarded throughout the research. It demonstrates compliance. It provides evidence that the research complies with ethical standards and regulations and policies. It supports transparency and accountability. Clear records allow for transparency in decision making and accountability in the case of audits. It also enables reproducibility and integrity. Good research documentation supports the reproducibility of research findings and maintains the scientific integrity of the study. And so lastly, I'm going to cover a few upcoming educational offerings as well as resources here at UofL. So we have a few upcoming sessions that I think are noteworthy. There is an Inspire session happening on September 23rd. And this is going to be an informative and interactive discussion. The session is going to include covering several case studies that were pulled from FDA investigations. So these are real-world scenarios and ways to strengthen compliance and to help develop strategies for how we would handle these situations at UofL if they were to occur. So please pass on this information, and I can put this link in the chat here later as we wrap up. Also, our office will be hosting a few sessions at Research Louisville that we hope to see you at. We've requested to offer them both in person and on Teams, and I believe we have those links available so you can register, so we can get those out to you as well. But we will have a session covering consenting best practices. We will expand on the protocol considerations that we discussed today. And then we will explore other hot topics such as fraudulent research participants or those faking eligibility, to also talking about studies with incidental findings and how to handle communicating findings to participants. So we have some good sessions coming up that we hope to see you at. I also wanted to include some tools that are available for research support here at UofL. And please, in the chat, if you have other tools at UofL that you found helpful, please share those so that we can all learn the various resources that are available here at UofL. But the ones I wanted to quickly touch on are first REDCap. So this can be used for building and managing your online surveys and databases. It can be used for surveys, case report forms. You can export data. It can be used for electronic signature. So there's a lot of different ways you can use REDCap to support your research. And the Kornhauser Library helps support REDCap, so they would be your contact for getting set up. And they also have a research portal that covers other services provided. That's the second link here on my slide. The third link is to the Louisville Clinical and Translational Research Center. And so this center helps support your research in a variety of ways, such as professional development, research design, compliance support, funding opportunities, and community engagement. So I encourage you to check out the website for the LCTRC to explore all the offerings. Lastly, here I link to the Clinical Trials Unit at UofL. They provide a wide variety of research services to departments conducting adult research, from budgeting, regulatory, clinical coordinator support, FDA guidance. They cover a lot of topics, and you can check out their website to see all of the different services that they provide. So in closing, just to wrap up, the ethical conduct of research is everyone's responsibility. Research organizations are responsible for providing education and training to enable ethical research and creating a culture of research compliance. And researchers are responsible for learning the rules for ethical research and following the rules in the spirit of respect for the study participants and the research process. So protecting the research participants is our most important job. And the HSPPO and the IRB are here to partner with you through the process. That is why we exist. So thank you for your time today. Please do not hesitate to reach out to our office at any time with questions. We do look forward to partnering with you As I said, that's the whole reason we exist, is to help support human subjects research here at UofL. And I will share these slides because I do have a few additional resources on FDA and OHRP regulations. I've also got a couple of tables attached to the slide deck that outline the different types of consent processes and the different types of documents that you would need to attach to your IRB submission. So those are helpful resources to review as well. So as I said, please don't hesitate to reach out to our office anytime for questions or brainstorming. Also, we work on Teams all day long. You can reach us there as well. And now we can open it up to questions.
All right, Christy, thank you so much.
Yeah.
That was a wonderful presentation, and I learned a lot. I've been doing this for a while, but I still learn a lot. So we'll open up for questions for sure. So anybody, if you have a question, either you, I think the best one for you to do probably is raise your hand on Teams. You know, this is a great opportunity. You know, you get access to the director of IRB. So all right, we're gonna open up Dr. Cave.
You're muted, Dr. Cave.
All right, thank you. Yeah, so I really appreciate you coming and giving this talk today. It was absolutely fantastic, and I learned many things too. You know, our center has a lot of PhDs in it. Many of them are new to clinical research, and through a core in the CIEHS called the TRSC, Dr. Wong and I are tasked with promoting clinical and translational research among our members, many of which are PhDs. And so was there a good contact, you know, for people new to clinical research and new to IRB, you know, in the office that we can enlist when these kind of issues come up for new investigators? New to clinical research?
Yeah, I would say me. I can be the contact and help direct and make connections. We do have staff in our office that support the departments as far as IRB analysts. We also have Kathy Carter, who does education and outreach, who can do group sessions for students as well as faculty. So I don't mind to be that point of contact, and then we can make the right connections.
Okay, fantastic.
Christy, I have a question for you too. So this is something I think a lot of physician and a researcher reach out to me and Dr. Keeve about. Is there any way to have if I got a pretty complex, at least I think it's a pretty complex research project, is there any way to do a pre-consultation with IRB? Kind of laid out, hey, those are the things I don't understand. I understand there's a lot of work for your staff. I know your staff are you're short staff. There's a lot of work. But what would be the right way to reach out to IRB for pre-consultation before submission?
Yeah, I would start with the list with the IRB analysts for each department and make that contact to the IRB analyst. We actually do that often. We don't have a formal way to do a pre-consultation. For a lot of the reasons you mentioned, it just resource limitation, but we actually do that. And it actually does save time on the back end because the study comes in more complete by having those sessions ahead of time. So I would connect with the IRB analyst for your department, and they can work with me and others in our office to set up a pre-discussion.
Great, thank you. Do we have any other questions from the audience? Today is probably the best attendance we ever had. So Christy, you have a lot of draw for the crowd. So.
Well, and I think the key takeaway is just don't hesitate to reach out to us ahead of time to just start the discussion because we're happy to help. Right,
Laura, you got a question?
Yeah, Christy, thank you so much for this. I was wondering if the IRB is providing any guidance to investigators and really to students about AI use and their research in thinking specifically about data sets and using that with AI.
Yeah, so that is a great question. So I am on a working group with myself, Dr. Ted Smith, Stacy McCutcheon, the UofL privacy officer, and Shannon Pipes, legal counsel, and Kim Adams in information security, really trying to develop guidelines for the institution of what the institution would expect as far as what data could be shared, what data can't be shared, when would a contract be required. So we are working towards some guidance on that.
Thanks.
And Chrissy, the other question, I think a lot of people talk to me about it is, I mean, you mentioned that not only you need IRB approval, you also need the hospital approval too. Wouldn't it be easier you have somebody from the hospital sit on the IRB? Like I know UofL Health might have that, the possibility for other hospital, like in Norton, probably the most likely one.
Well, and we do have ex officio members from the hospital. The challenge is the hospital's looking at it with their review process from a different angle. So from the IRB, we're looking at it from general human subjects protections, navigating through the protocol, where the hospital is going to be looking at it from the standpoint of impact on services, costs to departments. It's their protected health information. So while we do try to facilitate as much as we can with the hospital so that they have the information that they need, they're looking at it from a different standpoint. So everything the IRB asks for doesn't necessarily address all of the things that they look at. So I don't know if there's a good way to really marry the two. They're very different.
Okay. Paul, you got a question?
I do, thank you. How HIPAA and FERPA compliant is Microsoft Forms if we use University of Louisville's version? The reason I ask is obviously the REDCap would be much preferable. Unfortunately, if we're sending, and I haven't done this in a while, but if we're sending links to those in a hospital, particularly like Norton or Baptist or VA or ULH, their systems flag that as either junk or they flag it as inappropriate links, and so we have to provide a lot of special workarounds for that. If I send them a UofL Forms link and I make it such that it can be answered, by anyone with a link, then it's much easier for them to get it. If I send them to at nortonhealthcare.org or at bhsi.com, whatever, a hospital address. But I'm aware of HIPAA issues too in FERPA. So Can you give me any insight on that, please?
Well, I put a link in the chat to a document that is on the Privacy Office's website. The Privacy Office is trying to keep a running list of what can and cannot be used, or what systems the university already has vetted. And so I'm trying to pull this up on my other screen. I know Microsoft Forms is allowed because it's part of the Microsoft product that we've purchased as a university. What I'm not sure of is the HIPAA and FERPA compliance aspect of it. So I am going to put the Privacy Office email in the chat. Stacy McCutcheon is who handles that service account. She's the privacy officer for UofL, and she'll be able to answer that question.
Awesome. Thank you very much.
Okay. Thanks, Chrissy. The other thing I want to mention is we do actually between UofL and UofL Health. I kind of talk about UofL Health. We do a lot of research. I think most of our researchers do clinical research at UofL Health. We actually do have a team. It's the clinical research operating committee. So we have everybody touching the research leadership, RB director, we have the CTU director, we have the research director from UofL Health, we have direction from the sponsor program. So if you have any question regarding the clinical research, or if your study is stuck somewhere, reach out to me. I'll share my email in there, especially UofL health related clinical research. We'll figure it out. Even if we can't solve all the issues, but at least we can bring the issue forward and figure it out. I'll put my email and my cell phone number in the chat. Do we have any other questions for Christy? All right. So if not, Christy, thank you so much for the excellent presentation. How would you distribute the slides? Would you send to Colleen, or how?
Yes, Colleen, I will send those to you here after we get off of this call, and then you can share them with the attendees. I'm also going to send our registration links that I think have been created today for our upcoming Research Louisville events.
Oh, great. Yes, I'll be happy to send that out.
Thank you.
Great. And thank you all very much. And thank you for attending. And we will give you 14 minutes back in your afternoon. Thank you all.
Thank you.
Thanks, everybody.
Bye-bye.
Bye-bye.